So okay guys, we are talking about that platyphase. So platyphase is due to slow calcium channel influx. So what happens is there is an influx of calcium ions which leads to platyphase. So there will be a delay in the repolarization, which leads to formation of a platyphase. So there will be a delay in the action potential. We don't need to call it a delay in the repolarization. I don't want to say that one also. So actually there will be a delay in the action potential. So the platyphase is due to influx of calcium ions, slow calcium channel opening leading to influx of calcium ions, as well as the platyphase is also a background. There will be a decreased permeability to the potassium ions. So okay, so now the phase 3, there is a rapid repolarization. Why the rapid repolarization occur? Can anyone? Why does the rapid repolarization occur? There will be a closing of calcium channels leads to sudden increasing of potassium permeability. Closing of calcium channels follows with sudden increase of potassium permeability. That means potassium channel opens. This potassium channel opens leading to potassium what? Efflux or influx. There is repolarization. That means we are coming to negative potential again. That means potassium efflux occurs. Then it reaches final minus 80 millivolts again, which is resting membrane potential. Okay, reaches the resting membrane potential. Right. This is as simple as like this is what a cardiac potential looks like. So you just look into this. I just want to discuss some differences between skeletal and cardiac muscle action potential, skeletal action potential and cardiac action potential. Little bit differences. I think they can be Inicet MCQs, or they can also be Neet PG MCQs also. So kindly listen to this facts. In skeletal muscle action potential, there will be only one population. There is only one type of population, that is rapid sodium channels. There is only one type of channel populations. But here there will be two channel populations, two types of channels. What is voltage gated rapid sodium channels, or fast sodium channels, as well there will be slow calcium channels. Now you can ask me, sir, so in cardiac muscle we are getting calcium from the extracellular component. So calcium is obtained, or calcium in the cardiac action potential, calcium which participates in the cardiac action potential comes from the extracellular component, whereas calcium in the wait, I will just erase it. I think we should write it here. I will write it here. Here the calcium in the cardiac action potential, the calcium that participates in the cardiac action potential comes from the extracellular fluid, ECF, whereas the calcium that is seen in the skeletal muscle action potential comes from the sarcoplasmic reticulum, which is intracellular. These two are very important facts, right? Very important facts, right? Now so what is the resting membrane potential of cardiac action potential is minus 80, right, and skeletal action potential it is minus 70, right. So that is the differences between skeletal and cardiac action potentials. I think besides this there need not be much you might be thinking about it. So all in all, the most important thing in a cardiac action potential is the plateau phase. Remember this plateau phase is very much, my doctors, very much important, very much important. It can be a maximum, it can be a MCQ, it's a potential MCQ, right. So that is all about cardiac action potential. And if we want to discuss any other features or any other differences, what we might look, some other things, I think that's all enough for cardiac action potential. And I think we discussed everything in this graph. You look at this graph. Yeah, someone is asking about the refractory period. Yes, someone is asking about the refractory period. What is a refractory period? What is a refractory period? See, it is the time taken for the initiation of the successive action potential. That means, so you initiated an action potential, right. So actually this is the force of contraction that was given. This is the force of contraction. This graph is force of contraction, right. So this component is called the refractory period. So in the meanwhile there will not be any excitatory impulses. So even though you give an excitatory impulses, they will not reach the threshold value. For example, let us think like before reaching this one, you gave a stimulus. For example, it was excited. So even though it was excited, it will not exhibit maximum contraction. So you will not reach the maximum contraction. Right. So this is called as refractory period. Refractory period means the time period which is observed in between, or the time taken to initiate a next action potential. The time period in between two action potentials, or the time which is taken for the initiation of next action potential, that is called as refractory period. It's okay. So up to this we can finish it off, I think. So that is all about cardiac action potential. Just study this. This is all about, if you want to tell once again, this is the depolarization phase, initiation of repolarization, plateau phase, rapid repolarization, resting membrane potential, right. And I will tell the answers also. I will tell the stages and the ions also. Here I will do with red color. Sodium influx occurs, sodium channel closes, as well as the potassium channel's permeability increases. Calcium channel opens here, and potassium permeability completely decreases. Potassium channel permeability decreases all around the plateau phase. The potassium channel permeability is no more, and calcium channel closes. Potassium permeability again increases. This is potassium efflux, right. Potassium influx, calcium influx, potassium efflux. Okay, doctors, that's up to there. Thank you very much. Your wise doctor.